Bu. Це
Today is March 15, Ukraine Media Center, Ukraine Forum continues its operation. My name is Vasil Samakhvalov, and we start our next briefing. We were talking just half an hour ago about culture, and now we will be talking about health. Our guests today are Ihor Kuzin, Deputy Minister of Health of Ukraine, Chief State Senator Dr. and Fedir Lapiy, Chair of the National Technical Group of Experts on Immunoprophylaxis, Consultant on COVID-19 Vaccination in joint projects of the Ministry of Health of Ukraine with the World Bank. So the first question is very simple. If I'm not mistaken, the World Health Organization expressed some cautious expectation that year 2023 will be the year of victory over COVID. Will Ukraine be able to join that victory? If I may, I will start. The World Health Organization really made that statement, and maybe thanks to the world we are coming closer to announcement not of the victory but of some success in our struggle with COVID. All around the world, and specifically in Europe, the indicators of vaccination are at high level, which enabled the European countries not only to cancel the quarantine restrictions but also to achieve the indicators of mortality on a way lower level than in the countries that have lower level of coverage. So to mitigate the consequences of COVID, to join the family of the countries which can announce the victory over COVID, Ukraine has to make a super effort to renew vaccination, at least at the level which was existing before the war. That's the most important thing, and it's worth getting back to the statements made by Tetros that many countries are moving in that direction. It's very well, but every country should learn the lessons from the pandemics that was already passed. So the important things are the reaction and of the system of public health, and within those years of COVID that we went through together, the system of public health is more efficient and more powerful now. Another thing is the importance of science that he mentioned, and availability of vaccine which is efficient, which has proven efficiency to all the age groups, and how the science pushed the development of the vaccine is important for all the world. So important of the science in this context of urgent situations is a key thing, and cooperation is important too. Now that Ukraine joined its efforts with the struggle with the enemy, a lot of volunteer movements are engaged, but we remember in the beginning of COVID pandemics there was a lot of volunteers, a lot of organizations which helped us fight it. So this is the key element of the victory and prerequisite for Ukraine to say that we're moving in the direction of coping with COVID. So about the situation in Ukraine, maybe in more detail, I will add that there was a cautious forecast by the end of the 2021, then there was a cautious forecast by the end of 2022, and obviously we may say that the weight of those forecasts grows because we see how the situation develops with COVID-19. We check it on practice and we get convinced that the vaccines work, and the question is not that we are about to win or whether it will happen in 2023 or 2024. The question is about the price of the victory. because in the same way that when we were preparing to the winter season 2022-2023 in many countries, for example in North America and in European countries, just like in Ukraine, the level of contraction was growing. We had a peak in October 2022 and we were losing 20 persons to COVID-19 cases. And when we were saying that the vaccines don't work, one of the colleagues of mine, Polofit, a pediatrician from the United States, being an expert in vaccination, he said that the question is not about how many people will contract COVID, but the price we pay for it. If it will be regular flu which does not require hospitalization, if it doesn't take lives, human lives, that will be of no concern to us. And as Mr. Ihor said, having a high level of vaccination, high level of coverage, they brought the indicators of hospitalization to lower levels, and as well as mortality indicators, and we would like to suit it for us. But we understand that the situation with vaccination, specifically in the risk groups, is way worse with us. And how it would develop, we may only state what we are seeing now, but what we're seeing now is that within the last weeks we have a stable growth of contraction of COVID-19. It's stable within the last 5 weeks. We had a quiet period in the beginning of January, but within the last 5 weeks we have officially confirmed cases of COVID-19 added on weekly basis. Now we have 15,000 confirmed cases within the last week, and the statistics published by Ministry of Health, they are being used in the weekly digest for COVID-19, so we'd compare the dynamics. Those figures are available to everybody. So talking about the price, not about the quantity but the price, there is a growth in mortality rate, there is a growth of hospitalization rate, and now we come to the number of 100 person per week dying. It's less than in autumn, but statistics still remain sad for us, and the forecasts are not comforting, because the majority of those people who die are above 60 years of age, who should not be only vaccinated, but who should be vaccinated with the first booster dose, at least, just like they did it in European countries, in Denmark, in Spain and Italy. So we understand that COVID-19 will not leave us shortly. So how lethal are these stems, and what should Ukrainian society and Ukrainian government do to disable those threats? I will start maybe here. If we compare to the first waves that we documented, that Omicron and 10 subtypes of Omicron that circulate the country, we may state that the number of deaths was bigger, the mortality rate was bigger now, but we're talking about the time when we had no vaccines. Now we can minimize the number of heavy cases to bring them to minimum level. There is vaccine in Ukraine, there are mobile teams and vaccination centers open everywhere. They are open in regional capitals, and in case the persons are with limited mobility, there are mobile teams to vaccinate them. And there are various types of vaccines, and there is a new philosophy when people may choose from the whole range of vaccines. The type of vaccines is a big plus. So now we can prevent all those lethal cases. To make it happen, everybody should pay attention to their vaccination status, specifically if we're talking about elderly, specifically if people have some additional diseases. If people understand that they are employees of critical infrastructure facilities, if people use public transport, this is what increases the risk of contracting, and specifically on the background of some additional diseases. So for me, personally, what we have to do as the conscious citizens is to check when we were visiting the vaccination station for the last time, if we missed booster vaccine, or if we did not make we did not fulfill the basic vaccination, we should do it immediately. As to the forecasts that we have, the risky situation for us is the emergence of subtype of Omicron, which is called Omicron 5, because we understand that the emergence of this strain expedites the contraction from one person to another. On the background of staying in the shelters, it increases the risk of spreading the infection and increasing the risk of a more number of people contracting that disease. So this is what I wanted to mention in this regard. If you have anything to add, Mr. Ihor was talking about the name of a subtype. So we're talking about Kraken here. It's present in Ukraine, and yeah, this is what everybody gets intimidated with. Yeah, we take the details from abroad, from the United States of America, when it was first identified within December, within the month of December and a little bit of February. It reached the indicator from 4 to 40%, and now it accounts for 80% of cases within very short period of time, comparing to other variants, other substrains. The domination, so for a strain to become dominating, it required a lot more time. And again, we understand that for the time being, people in the risk group are very bad vaccinated. The figures say for themselves. In Ukraine, according to the official statistics, we have a bit more than 15 million people who received 2 doses of vaccination. So if we see the statistics for those who received first booster, they are 3 million. So 15 or like 12.5 million people who could receive first booster dose, which we need to reach the maximum protection effect, including for Kraken substrain and for the risk groups. So for the time being, they are those who are the majority of those dying. They are the lion's share of those dying. So my colleague from Lviv, managing the control and prophylaxis of diseases, submitted the statistics that out of the 18 of the lethal cases, 17 were never vaccinated, and only 1/18 was vaccinated with 1 dose. So this is what we're talking about, the price that we pay to go out of the COVID-19 pandemics we were warning. And it's easy to check it that there is seasonal nature for COVID, and it can be clearly traced. We were talking about it 2 years ago, about the growth of level of infection in autumn, and in the same way we announced it in the year 2022 that we were peaking in October, and we have reasons to assume that the autumn of 2023 will not be left without growth of infection. And in view of spreading rate for Kraken, and in view of the fact that many people in the risk groups are not vaccinated with even one dose, we will be harvesting a lot of hospitalizations and mortality cases. So now we have 15,000 cases per week. If they don't require hospitalization, it's something of no concern. It would have been something of no concern to us. But the breakdown is as follows: a bit more than 4,000 are being hospitalized per week with COVID-19, and they are not the first patients like in Chernivtsi without symptoms, but they are the people who really require hospitalization. What is 4,000 hospitalized per week when there is war going on, when the healthcare system, when the load on healthcare system is huge? So one hospital is 450 bunks. So there are 10 regional hospitals that are loaded with the diseased, with the sick people, with the infected people. Vaccination could prevent it. So my question is about Kraken: which vaccine is most efficient against them? And another question is, what about the vaccination in the Ukrainian army? Many people are in the front lines and they have weakened immunity and other conditions that may contribute to spreading of this infection. As to the study made in relation to the vaccines remain effective against Kraken as well. Any vaccine, yes, any vaccine used in Ukraine are efficient against Kraken just in the same way as they're efficient against other ones. So today we use CoronaVac, which is well known to everybody, Johnson & Johnson vaccine, which is one-shot vaccine, and we ask it to be used in the level of some remote settlements because it's easier, and Pfizer. Also, there is a separate vaccine for children. We have not to forget that at least 1900 cases are registered among the kids on a weekly basis. As to the vaccination in the armed forces and law enforcement, there is close cooperation, and upon demand we hand them to the armed forces. This work is coordinated, and during rotation or other actions, medical department of the armed forces does everything possible to have our defenders protected and vaccinated. I will add, like sometimes I get questions or I keep track of the professional space. So it's worth mentioning that when we talk about Kraken in Ukraine, there is equipment to identify the variants and subvariants, substrains. So we're talking not about the fact that we heard it in Europe, but we identify the substrains in Ukraine. If we want to achieve success, there is the number of components. There is executive power, and they have to ensure the availability of vaccine. As Mr. Ihor mentioned, there are vaccines from 3 manufacturers, and there are 8,200,000 from the beginning of the month. We have CoronaVac, Pfizer for kids, and Johnson & Johnson. So we are saying that they may be combined, and based on the scientific data, people may pick something for themselves. There is enough capacity in the healthcare system. Regardless the war, the medical care on the deoccupied territories is being reestablished quite well. There are mobile teams going out on missions, and from the 1st of April, the authorities for vaccination will be transferred for the Center of Control and Prophylaxis of Diseases. they have an intermediate period. That's another component to ensure. We're talking about the system for provision of medical care, and another component is the people. Nothing will work without people. Do we have people? Yes, we have the vaccines, we have enough of vaccines, we have the system which is capable of vaccination, and if the people don't come for vaccination, we will expect the growth in spreading of infection shortly. There is a clear seasonal nature, and in summer the level of infection will go lower, but autumn will come after the summer, and we have to get prepared to the new season. What will be the price we are about to pay for the next season, but how COVID-19 will be evolving, how it will be moderated in future. No single virusologist expert will be able to forecast it. They will say, we don't know. We see that now there is some stability of mutations, but we know that the vaccines work. But in the case when we talk about the primary vaccination, with those 15 million people who received it, but there are only 3 million who received first booster, but there are groups of population who need to receive second booster in view of them belonging to the risk groups. We have questions on the floor. Angelina Strashkovich, Ukrinform. First question regarding the Omicron strain that you mentioned in the beginning of March. Ministry of Health reported that it's documented in 6 regions. Was the situation with this spreading? Is it identified in more regions? And another question is about XBB.1.9 substrain, which was identified in drainage waters. Is it spreading across Ukraine now? Well, for the time being, statistics across the 6 regions remains unchanged. But what we're seeing within 2 to 3 weeks is the growth of Kraken from all the pool of research that we're having. So if we used to identify it in every 10th or 20th case, all the samples that come, for example, from Western Ukraine are all Kraken strain. So it starts gradually prevailing, and how to say it in other words, it pushes other strains out, and it becomes the prevalent in all the cases documented in Ukraine. As to the strain identified in drain waters, I will say a couple of words how the system of epidemiological surveillance works. Just like Mr. Fedir said, that equipment is quite expensive and the research is quite expensive. So to test one sample, we spent about 1 week of work, and it costs about $250. So to be able to identify more of such strains, we research drain waters when before water treatment the water is sampled, and we may detect the whole range of viruses present there. So this system of surveillance and control works, for example, for other viruses, to be able to say that for example, polio virus doesn't exist in this or that area, so everybody who used water in those territories or the drained water from those territories that we researched, they do not contain that polio virus. So the strain that we mentioned, it says about that it's yet another substrain which circulates in the population, but that was a single identified case, and we don't see it becoming prevalent and absorbing other types. And in the same way, we don't see it according to the data of international organizations, and we don't see it as more hazardous or less hazardous. But we keep monitoring the situation to be able to see what are the prevalent strains in this or that part of Ukraine. I have another question to you. When we were saying about the factors that may make the spreading of coronavirus safer, you mentioned the consciousness of the population, but it was previously forced by the government. Can we return that pressure to increase the level of vaccination? And the situation that was discussed previously, will we ever have this collective immunity which will allow us to refuse vaccination in future? Well, let's start. If I may, I'll start with the issue of collective immunity. We all have to understand that immunity will never be persistent against respiratory viruses, and it has a seasonal nature that we documented within the 3 years of COVID, and this seasonal nature is being documented within centuries, for example, in cases of flu and cold. So we may say that coronavirus infection starts getting this seasonal nature, which tells us that most likely this vaccination will be a part of collective vaccination that we always start the season with. I want to remind you that the flu vaccine is available in Ukraine. We received a record number of vaccines last year, and this approach, when before the beginning of the season at least critical groups of population get vaccinated, so this approach will be proposed within the next couple of years, so to create this group immunity, to forget COVID and never recall about it. In my opinion, that will be impossible. So talking about some mandatory nature, compulsory nature on part of the government, we are interested in having all of our employees of critical infrastructure facilities protected, but whatever we do, we have to understand that critical infrastructure facilities should keep operating uninterruptedly. Safety, security depends on it, efficiency of the government depends on it. We cannot afford having the employees of critical infrastructure facilities falling ill all at once. What if it happens in some facility like water supply facility or power supplies? So we consider an option to have the critical infrastructure employees vaccinated on a mandatory basis, to have them protected. From the point of view of having protected the people above 16, of those who have to be vaccinated due to medical reasons, it's an important fraction of population, and it's important for them to get vaccinated, but we count on their consciousness. Anything to add from the adherents of the theory of Spanish flu? Well, Spanish flu has not gone anywhere. When we talk about the virus and we compare the virus of SARS-CoV-2 with the flu virus, the flu virus is the leader in mutation, but it does not nullify the problem of COVID-19 when we say that Kraken is a light strain. In that case, we wouldn't have had 4,000 hospitalizations and 100 lethal cases per week in Ukraine. So if that infection wouldn't have been so important for us and we could have neglected, still there are lethal cases. And if we say about some remote consequences like heart stroke or brain stroke, we know for sure that there is a tail which is coming after COVID-19. There is residual mortality compared to previous years. We see that many people die due to the stroke, to the heart diseases, and they are not being added to the official statistics. Now you have, for example, confirmed COVID-19, you are being hospitalized, you didn't walk out of the hospital, you get into the mortality statistics, but there are long COVID consequences. And we get more and more scientific confirmation about the efficiency of the available vaccines in prevention of hospitalization, but also we get data on the long COVID, the consequences and reduction of the risk of stroke and heart attack, which unfortunately is not being taken into account by my colleagues, and based on those reflections we would be able to say about the protection against many diseases that Ukrainians suffer from. As to the collective immunity, well, that's hardly going to happen, but it doesn't necessarily mean that the work is not underway on universal vaccine, and that we would be able to ensure the protection about a number of strains. For example, now there is a vaccine being researched on beta coronavirus. It's SARS-CoV-2, all those united under the category of coronaviruses. We have efficient mechanism now from what we see, but we don't use it due to a number of reasons. So if we don't have more questions on the floor, I am having the last question: how all this story influences the public behavior, the attitude of people to vaccination in general, not only as to coronavirus but in other directions, and how do we revert to those trends that we had before the war? Well, I will start with the fact that influence of COVID in the world scale and in the scale of Ukraine was quite significant, and it remains significant because the first block, if we don't proceed to the change of consciousness of the people, the COVID influenced the infrastructural change of the healthcare system. Before COVID-19, the availability of external lungs ventilation devices was 2.5 per hospital, but now there is no single medical station without this device, and everything that is related to medical assistance in the background of COVID, those capacities were improved, reinforced, and the system of medical assistance switched not only to response and reaction, it became more efficient from the point of view of provision of emergency medical aid. As to the transformation of the society, there is a number of positive moments for us. Each of us understands now what is epidemiology, what is external ventilation device, and what is collective immunity. And we are conscious that the infections did not disappear, they did not go anywhere, and we understand that there is a protection against, and the population, even the professional crowds, we have the evolution of the ethics of sneezing, of coughing. We know how to treat our hands, we understand what are the zones of increased risk of infection, we know what to do when we enter the subway or any other public transport, when we should put on a mask or when we should even stay at home. Another positive thing is that COVID became a push to the development of information services in the healthcare system. I think that many people remember there were total lockdowns, they were strict, and they were not able to have some medical documents observed, and it became a driver to have the medical services available online, for example, when they don't require a personal visit to a doctor, like electronic prescription, electronic illness sheet, and everybody now associates it not only with the service, but there is a vaccination certificate available in DIA application that will, I hope, reflect some planned vaccination in future, and the number of all those changes is tremendous, and I think they will all be preserved because the new infections will keep coming and we never know when, but it's obvious that the new infections will emerge, and those skills that we used to have, all those skills, the information, the practices in terms of infection control, we have to preserve them because it's just the matter of reason. Thank you. Well, obviously we will not be the same as we were before the COVID-19 pandemic, just like Spanish flu changed everything in the healthcare system. COVID-19 will change not only our cultural environment, but new medical technologies will come to us because the technologies of mRNA medical interventions, they were developed back in 70s or 80s. We already knew about them, but talking about muscular spinal atrophy, I think everybody was seeing those postings on the walls of subway for raising funds, the charity funds. Now the Ministry of Health already implemented screening for the newborn kids. So those are the mRNA technologies that treated that muscular spinal atrophy. So imagine they are already part of our lives, which are now used in creation of medicines that will be manufactured for those who are desperately ill. But talking about Ukraine, we cross some psychological barriers that Mr. Ihor mentioned about. For example, when we say that we have to put a mask on yourself when you are sick, but for example you cannot get isolated, you have to go out for some reason, but now we put that mask on without shame in the subway and it's normal. As to the vaccination itself, even in medical environment, in professional environment, it was demonized in Ukraine. Unfortunately, there are still many islands of demonization of vaccination, otherwise we wouldn't have had that low level among the risk groups. However, just remember how we started with vaccination in 2021 when we were talking about the stations for mass vaccinations. The discussions in different talk shows that we vaccinate people in the toilets, in the train stations, and we were vaccinating them in some mobile stations. Now we have a practice that is available in Europe. When you don't have to spend time for visiting doctor, you can get vaccinated in the pharmacy. We had millions of people who were vaccinated at the mass vaccination stations, and we have result. And the result is that millions of people are protected. They received at least I mean 16 million in total, they received at least one dose, and 15 million at least two doses. But those are the people who cross certain barrier. That's some cultural environment, certain culture to wash our hands, to get ourselves protected against infectious diseases, and the result is it's safe, it's normal. In some cases we say about the European culture that we implemented in Ukraine, and now we have other intentions as well to have vaccination against COVID-19 and other infectious diseases to be more and more available. So we have to cross those barriers to have the people protected against flu, against smallpox, and we cross those barriers because in Ukraine we have to be ready for vaccination. We have to be ready to vaccinate the risk group, and in order not to undergo vaccination you have to have some medical condition, and those chronically ill are those who require vaccination the most, those above 60. And another question is vaccination of the pregnant ones. I remember how it happened 15 years ago. God forbid to ask a pregnant woman for vaccination, but now we have tens of thousands, if not hundreds of thousands, pregnant women because they are in the risk group, and the risk of hospitalization grows dozens of times for them. Now we have safe and efficient vaccine to protect them against COVID, and many pregnant ones, they get vaccinated, some upon their initiative, but some in case when the medical healthcare employees, they cross that barrier. So now we have this culture, and that culture will result in the culture among the medical employees. Thank you very much. We were talking about COVID-19 and healthcare system. Our next briefing is at 14 o'clock. We will talk about employment and unemployment. We will talk to the Ministry of Economy. See you shortly.